Whoever would thought we're not only caring, you're not only caring, or I'm not only caring, we're caring during a COVID pandemic. As if we don't have enough on our plates, eh? But this is, I suppose, I'm very interested in how the psychology of all this. At the end of the day, I'm a psychologist too, and quite often people are it's ratcheted up our levels of worry, concern, stress, and anxiety, particularly if we've a more vulnerable person in our house. So how do we? Quite often people are scanning the news, scanning the information, scanning. And scanning is actually an anxiety behavior. If you find yourself over scanning or over checking, that's one of the things that's only going to increase your anxiety. So what I'm saying to you now is, the way I'm thinking about this is our circle of control, our circle of concern, and our circle of influence. So we can be concerned about everything, but we can only control what we can control. And if we stay in this area around our social distancing, our face masks, our hand washing, sanitizing, cough etiquette, maintaining numbers to a very low level in our environment, trying to manage they're the controllables. And if that's what we can do, then that's the best that we can do. If we step into the other area of concern, we're just going to get overwhelmed with the amount of information that's out there. So let's follow really good practical guidelines. Let's follow the scientific evidence that's out there. Check out hse.ie and the government websites, because the public health services is what they're going to give us good information. And let's mind ourselves, because in this period of a pandemic, it's important that we too are minding ourselves. It's not just about caring for those around us, but it's also caring for ourselves. So similarly, the same rules apply to us. Hand washing, social distancing, face masks, all very important. We're living in a pandemic, COVID, with lots of concerns about it. And actually there's a link between this whole COVID situation and acquired brain injury, in that they're both hidden. They're unknown. Many carers either live with an individual with acquired brain injury, or some people with acquired brain injury, it's a hidden disability or hidden injury. And so too is COVID. And I suppose that's one of the links. But it's important about self-care. It's important about following the messaging around social distancing, wearing masks. I think people are getting overwhelmed and fatigued. Initially in the COVID period, it was let's all put our shoulders together, let's all roll up. And now people are like I see them like goats in a field, running all over the place. And people are getting concerned, agitated, angry, frustrated. These sound very familiar because you've seen these in your carer's role as well. But what we can control, something we can learn around COVID is same things. The things that help us control our anxiety around COVID, in terms of the good social space, masks, cough etiquette, washing hands, what can help us similarly? What key messages can help us similarly when it comes to supporting an individual with brain injury? I'm inviting you to think about that, and I'm inviting you to stay with us as we go through the rest of our program.